welcome to the Younger Body and Mind podcast, where we help you thrive 50, 60, and beyond. I'm Melissa.
And I'm Billy.
I'm Dr. Habib.
And Dr. Habib. Yes, he's our amazing guest. He's back with us for the second time now, and we hope to do many more episodes with Dr. Habib. Today we are talking about inflammaging, and can we slow the fire of premature aging? And that's the topic we're going to have today. So why don't we just dive right in with Dr. Habib. Is the founder of nexthealthmed.com. You can look at his site. You can visit his practice in Ashburn, Virginia, which I've had the pleasure of doing. And so there's a lot of things that he's going to share with us today. And so let's dive right in.
Right, and this is such an important topic because there are many people that would say that inflammation is at the root of almost all of the problems that we endure with our health.
Well, we're going to dig into the science so it's irrefutable and reversible.
So I've always heard that inflammation is the precursor to disease. So I'd love to hear your thoughts on it.
It really is. And I just want to let you know, I'm in Bethesda too. Okay. So there's the healthy inflammation, which is like when you sprain your ankle and you get swelling, you get inflammation, it recruits your immune cells so you can heal. So if you can't do that, you won't heal. And you can take that to people who are in the ICU and they can't mount an inflammation response, they'll die. And then the one that we're going to concentrate on now is what we call chronic inflammation. It just doesn't stop. It's unrelenting. The power of the immune system is going to bear on whichever part of the body it decides to settle in on. And the reason is everybody's DNA is different. So the outcome of inflammation may be different, even though the signal is almost the same for everybody.
So how do we go from the good inflammation, because we always talk about inflammation associated with strength training, breaking down the muscles, there's inflammation, right, and the muscles rebuild.
So many things
right.
in the body that now you hear negative things about it, but the reason we have those responses is because there are benefits. So it's all about that balance. So how do you find the balance,
right.
the right level of stress, inflammation, good things in the right situations?
Well, I think that you kind of gave so many good answers that you don't take it in isolation. So if you've got all these other things going around, inflammation collectively is probably bad. We'll explore those today. The way to think about it is when it comes to the acute inflammation, in general, the body knows what to do. The gray zone, the gray means the in-between. You've got it's just not working at all, or it's just way out of control, like sepsis. You have inflammation, it's uncontrolled, you'll die, unless we get to the root of it. And that's a very important term, get the root of inflammation. That will be really critical in deciphering, is it harmful and how do we solve it? So I would say that mid-zone where most people are suffering, particularly doctors are not well equipped to deal with it, is dysfunction or dysregulation, which means that it's neither this way or that way. It's kind of going all over the place. And we're trying to capture it and understand it. So it's like an art of medicine.
So where does it go wrong? So it's happening in our body. It's a good thing. It's helping our body to heal. But if it stays around too long, it becomes chronic. And it becomes this inflammaging term, which I had to look up, by the way. I don't know about any of you that didn't know what this was, but I think it's a great term, but it's not something that we want.
Well, let's connect the two extremes. One is dying, death, and living longer. So the reason why inflammaging or inflammation leading to aging is because in short, the inflammation is damaging every single tissue and cell in your body. And so that doesn't take a rocket scientist to figure out you're going to age prematurely. And that's brought out in all the data that we have. That means measurement of so I measure biological age. I can tell you who is prematurely aging, right? At the beginning, and people who are on my programs, I can tell you what happened to their biological age. In general, is better. And then the other part, which is very serious, would be say, and I believe you have an example that we should go over at some point, is that inflammation is the number one cause of heart attack. And heart attacks are the number one cause of death. So the number one cause of death or dying is from a heart attack or heart disease. Number two is cancer, which I think is one and the same. If you've got cancer, you're going to die of a heart attack. But let me speak clearly. And the third one, the third most common reason to die would be complications related to the chronic medical diseases But I think it depends on the age group as well, because if it's a young person, they die of accidents and stuff. But anyway, number 1, 2 is important.
So let's talk about what is actually happening in the body with inflammation. What exactly is it doing to harm the heart, cause cancer, harm the cells? What's actually happening?
So I'm going to give you the...
And then how do we stop it, which is what we all want to know.
Right. Hey, there are 2 questions. You have to probably ask me that second one again, because I'm going to go on. So I would say that the inflammation has no boundaries. It can actually cross the blood-brain barrier. Just to give you an idea, there is no boundary. And the inflammation that is chronic is not going to cause imminent damage or death, with a few exceptions like sepsis. I just said that to get your attention. But I didn't say heart attack lightly. That is the number one of the maybe 70% root cause, not cholesterol, not even LDL. It's inflammation, right? And we can talk about that too down the line. So the part about inflammation would be that it's chronic. It's not a moment in time, but over a period of time. So that's where looking at the history and looking at other factors going on, and not least where the problem areas. Is it the joint? Is it the skin? I mean, this morning, a friend of mine was describing how his kid's got eczema, is getting worse. And another kid who doesn't seem to have any skin problem has real social anxiety. So this is a good lead for me to say the answer is through the gut.
Okay.
So there are many sources of inflammation. The simplest one to understand, and probably very, very important, is the gut. So when you have an imbalance in the microbes in the gut, you are setting yourself up for parts of the immune system that release inflammation. And just to connect the dots, that inflammation will travel in the bloodstream, so it's no surprise that blood pressure is associated with it. And that blood flow goes then to, supplies the heart, and somehow the heart attack is part of it. And the blood carries it through the blood-brain barrier. So Alzheimer's is part of it. So I think you said it already, but I'll reiterate. There is not any condition, or most chronic conditions are preceded by inflammation. You can take that to the bank.
Right, and you were talking about the, gut involvement there. And I think one of the things we have to realize, we're talking right now mostly in terms that make inflammation, a physical response. But the brain plays an important part of that too, because it's the stress that can lead to inflammation. Stress can disrupt your gut. And so, we have to look at the body as a system. And so we have to balance, a good mental environment, good mental state can also help reduce some of the problems that the physical changes or environmental effects can have on the body.
Yeah, very important point. We talked about numerous places that inflammation can come from, and now there is no doubt that the brain can be a source by itself. So basically we found the track where it goes down the vagus nerve and connects through receptors that communicate through certain organelles in the spleen. Then finally these communications, again through the vagus nerve, that's more like a highway, then going into the colon to create inflammatory bowel disease. So that's not for everything, but the point is that we've proven that the brain can send signals to create inflammation in the bowel. And the reason why I suspect that study was carried out is probably because relatively young people suffer from inflammatory bowel disease. You can call it Crohn's and ulcerative colitis, but they're both inflammatory bowel disease, and sometimes it's not worth differentiating the two, except for the fact that they have slightly different symptomology, but they really have pretty similar outcomes, and the treatments are very, very similar. So the point would be that when the gastroenterologist is trying to treat it at the local level, they may be missing a significant chunk, and I'm going to hazard a guess, 1/3 chunk. That's 33%. That's a lot, just in case we had to work out the math. It's a lot.
Right.
5%, 10% is a lot, because this is life and death. It's a lot. So the point would be that that they have to bring in the power of the brain in activating in a healthy way. That channel that came from the brain can do both. We just proved that the brain can cause the inflammation, and now the brain or the gut could be utilized through the vagus nerve to mitigate that injury. But from the brain, I would try to keep it simple. Would be yoga, meditation, anything where you can tap in to the brain and how it communicates through the vagus nerve. And unfortunately, vagal nerve stimulators won't cut it. But keep trying in terms of calming that brain, getting control of the brain. And the breathing is probably one of the best ways to start that process. And then you can go to higher levels like yoga and Tai Chi. I don't want to not mention all these names, but many of these mindful exercises.
So let me ask you then, so is the primary place that inflammation occurs the gut in most cases, or where does it start in the body? Where do we think that it starts?
It's very interesting because, first of all, how are we diagnosing it?
Right.
So let me tell you what's out there. So when we look at the blood test, there's an inflammation marker called HSCRP, highly sensitive C-reactive protein. You don't have to memorize that. I'm just saying there's a marker out there that your doctor can do, but they're not doing it.
Okay.
Why aren't they doing it? Because there's no drug solution. There's a lifetime solution. So that's why I think the gut is something we're going to talk about. But let's talk about other inflammation. There's the inflammation that you see for rheumatoid arthritis and lupus. That's a very destructive one. So it's a big inflammation, and the marker for that is the ESR, sedimentation rate. Now, I'm not just saying that to sound impressive. I'm just saying that I'm saying all this because there are all people in the audience who've heard this stuff,
right,
either from their doctor or somewhere. And I'm trying to, we are here to help you understand.
I think there's an expectation as you age that arthritis is something that you're going to end up with. We don't buy into that, and we're hoping to change that, and that's why we have this podcast. But I mean, so many people seem to accept arthritis.
Right, and it's one of those things too, that markers that we use to indicate that, oh, this person has arthritis, don't always correlate to discomfort and pain from it. We've had students that have gone in and been diagnosed. The doctor says, oh, you have arthritis through your arms, through your feet and hands, you must be in a lot of pain. And they said, no, I've never noticed it. So many things, stress is a whole nother topic to get into, but is related to inflammation. And so sometimes, what we see, experience as this problem is not always the underlying problem, it's how our system reacts to this.
Well, let me take that to going back to the causes. Mm-hmm. So let's talk about, say, rheumatological inflammation, which is pretty high, can be high when it's active. We call it active when it's high, and it may be inactive when it's low, but it goes up and down. So that SED rate is very, very high, and it can be synonymous with joint swelling, which is visible. So, but did it come from the joint? It did not come from the joint. It came from the immune system traveling through the blood and then sending signals at generally the joints that have a membrane called synovial membrane. So then that applies to the brain. When you have inflammation in the brain that we see over and over, I mean, pretty much 100%, in Alzheimer's and other neurodegenerative diseases, it didn't start in the brain. It came from somewhere else. Again, it goes back to where is this inflammation coming from? There are many areas, but we're going to go back to the gut because it's such a common one and well understood. There are other areas which is slightly less understood. That means it's at the research level, which we'll bring up actually. Why not? So that at least you can hear about it. But the gut comes up because the bugs are really, really important in ways that we're just beginning to understand at how they control the immune system. So the inflammation is not coming from the gut directly. The inflammation signal is released in the liver. But the liver is releasing it because there are signals coming from the gut, namely the microbes. So indirectly, so this is the problem with the current medical setup that we have. You have blood pressure, well, this is your drug. We don't know the cause. This is your inflammatory bowel disease, here's your drug. We don't know the cause. I mean, the gut microbe might have a lot to say in it based on what we just said and what common sense would tell you, right? So we're going to be lighthearted today. So we're going to talk a little bit about poop or shit, because it's real medicine.
Yep.
And I can even talk about fecal microbiota transplant, shit transplant.
Yeah.
Well, let's start off with, if I tell you the dramatic stuff, you'll see the value, and then we extrapolate, not directly, but we extrapolate, I mean that we'll talk about all the nuances. So when someone's dying of colitis from an infection source, so there's the colitis of ulcerative colitis, that's an immunological, rheumatological, like Crohn's disease, autoimmune disease. A smaller version, a lighter version would be called hypothyroid, alopecia, skin issue, or hair, and then vitiligo, skin pigmentation. So there are milder, middle, psoriasis can be in between, like just a skin problem, or a lot of skin and joint problems. Imagine that, skin problem and joint problems. It's called psoriatic arthritis. Okay, so the part we're talking about, if I don't lose my chain of thought, is that severe cases of inflammation, such as colitis from an infection source, is called C. diff colitis. So we all have C. diff, but in small amounts. But if you have an imbalance by taking an antibiotic, most of it's because they took an antibiotic and then all of a sudden they flourished. And we're just going to talk about the basic stuff, because there's a lot more detail that we should be thinking about. So this colitis can kill people. So especially when the antibiotics don't work, you're using heavy-duty hospital antibiotics. That means in the hospital, in the ICU, probably
IV, right.
on IV, you got vancomycin, you got all these big guns. And if all those fail, you're really up the wazoo, whatever that phrase is. So the point would be that maybe 10 years ago, actually, let's not say 10 years ago, I was in residency and finished in 2000, just an even number, 2000. So what are we now? 2025. Depends on when the show goes out. 2025. We got to push it. Your 2025 will be over. Okay. Whenever this show goes out, this is fact forever, right? Well, let's just say a quarter of a century, because it sounds terrible when you say quarter of a century. I told somebody 25 years is not the same as quarter of a century. Quarter of a century sounds really old. That's how old the medical system is. But I'm 25 years young, though. So in the last 25 years, quarter of a century, we've realized that putting poop into people that are resistant to the antibiotic, so the antibiotic is not curing the colitis that they're going to die from. They will die from it. In fact, an 18-year-old died in residency because they couldn't control it, right? Because what he needed was poop transplant. But 25 years later, we now can get the poop without the poop. We get it in a capsule. Okay. Either live, we call it fecal microbiota transplant. You swallow it. You don't have to do it down there anymore. And then there's a lesser version, which we can't call fecal microbiota transplant, but it's the microbes from the feces, but it's been inactivated, and those still work in a different way.
They're replacing what was lost by the antibiotics. Is that really what's happening?
Yeah, so for the treatment, we would have had to do the fecal microbiota transplant, but now you can just put the capsules orally, and that's restored. Can make it, not 100%, but really a game changer.
Wow.
In the setting where they're always going to throw antibiotics first,
right.
Which I wonder, is that really the first thing to do? Anyway, I can go on. I bet I shouldn't.
With the bacteria and the microbiome, you have, even without, modern antibiotics killing them off, I think there are studies showing that there are some bacteria that may have died out that historically humans have had in their gut. And because the environment has changed so much that it doesn't support those bacteria. So a lot of changes we are seeing in the environment. I should point out that the current generation in the U.S. is the first generation that has a shorter life expectation than previous generations. In the U.S., every generation has had longer life expectancy.
That's so disturbing,
yes.
Given the knowledge we have today.
Yeah.
But we'll get back to that. That's another topic.
Can part of that be that the damage that's been done to the bacteria that we normally have in our microbiome? And that would lead right into more inflammation.
Yeah, so I think we should be aware that the microbiome comes at the point of birth, when we're coming through the birth canal and we're populating it that way. It sounds hard to believe, but that's what the science is pointing out. The next is through mother's breast milk. So if people, for a while, it wasn't fashionable to be breastfeeding. Now those are, and amongst other things, there's some special fats in breast milk that are absolutely amazing for the brain. So there's a lot of consequences with the microbiome implications, and also even neurological if you're not born the right way and breastfed. Okay, now no judgment, we're just saying that's what the science is showing. Now, it's not the end of the world because all my kids were C-section, right? And 3 of them were breastfed and 1 was breastfed, but not as long as we would have liked. So their microbiome will be compromised, and they're all been pre-educated, now they're educated. So they won't listen to me at the beginning. Now they're older, they didn't forget. They're actually, they're carrying it out. So I think I'll take credit because I just said it gently enough that I didn't turn them off.
Seed and you, yes.
Exactly. Thank you very much.
It's amazing how children, their parents get smarter over time.
I have a long way to go. So, but going back to the microbiome, that's how it starts.
Okay.
And so it's not theoretical. The antibiotics, the number of antibiotics you have, there's conclusive linear relationships of increased risk of cancer later on, increased risk of all diseases. It's a linear. In medicine, it's never linear because linear is almost like an equation. The human body's not an equation, but with the antibiotic, every data point they had was a linear increase in all diseases, with the brain, the cancer, and gut problems as well. So by using antibiotics, so the more antibiotics you use, the more problems you'll have. The less you use this, it's like, how is that so clear? That's how powerful it is. So the microbiome won't disappear on you, but over generations, maybe it has changed, no doubt, with industrial age. But so your microbiome is waiting for signals, good or bad, and adjusting every day, every minute, every second. And so you can nurture them by feeding them the right way, or you can harm them. And I just did one of those on a Saturday night, because I watch a little mixed martial arts. I was telling my son, you got to eat a little junk food when you're watching this stuff. It's not fun without it. And boy, my microbiome changed. Because we have data to show that
Really, just one night of eating poorly can really have
it goes back to what you said. Now, I didn't have to bring it up. It's like, why not? I just did it to myself yesterday.
Right.
And I won't go into the nitty-gritty because you will probably leave the show. We don't want that. But I will say that we do breath tests, which took a long time to be accepted in the gastrointestinal world, to say that when you have an imbalance of these microbes, can we measure that? Mm-hmm. Can we accept it by taking a biopsy? No, it's too variable. But then finally, they were arguing against the breath test, but eventually they said, you know what, yeah, you got to accept it. So if you have an imbalance, the way we kind of try to classify it, especially in the setting of irritable bowel syndrome, which is not irritable bowel, it's actually dysbiosis, which means an imbalance, which now says that if you have a certain type of bacteria producing hydrogen sulfide, not strictly, but more hydrogen sulfide, which is measurable by breath test, you may have more diarrhea. If you have more methanogenic bacteria making methane, you'll have more constipation. I don't buy into one camp or the other one. At least we have the science to say that there is an association, and the breath test could be a tool to get there. Certainly the breath test, when it's positive, means you have a dysbiosis. Okay. And if it's temporary, not gone, and it won't go away with a little fasting, it won't go away over time, then we need to consider this, because even though this is a type of irritable bowel, a dysbiosis, but it's in the small intestine. But those bugs didn't come from the small intestine, they came from the large intestine. That's a problem.
Okay. So I want to try to shift now to, because I have a lot of listeners out there listening to us saying, okay, I took a lot of antibiotics, or my kids took a lot of antibiotics, or I have inflammation in the body, I have arthritis, I have different symptoms. Yeah. What can we do?
Yep. So there's always hope. So let's do an algorithm. Okay. First, get data points where you can. And I said this to the person I saw this morning. It's like, we know it's a gut. They just said, I have a bad diet. It's like, come on, okay, we know what it is. But still, this is the formula. Always start with the basic data point, the blood test. It's not the best in the world, but if they pick up, then, number one, you can monitor it. But number two, it's bad enough that it's in the blood test, right? If it's not in the blood test, doesn't mean it's okay. Then you got to go look at functional tests, right? The functional test is like, you can either look at the poop itself, and you can get a lot of breakdown of the digestive system, of the microbe system, and the byproducts, and the overgrowth, and imbalances, and inflammation, literally. And there's also blood tests, which can look at food allergies, but can also see what came over. Did the fungus come over? That means there's overgrowth of fungus. Okay. Did the bad bacteria come over? Because we can measure the antibodies. Mm-hmm. So you have even an overgrowth of bad bacteria. It's not exclusive, but if you have it, you got it. But if you don't have it, doesn't mean you don't have it. Then you gotta take the history. So I would say that the blood test is the low-lying fruit because it's relatively inexpensive. The same blood test we just said that doctors treating blood pressure and your primary care doctor should be doing, and some of them do, but they don't know what causes it for the most part, but we do. And if they don't do it, why not? And so the algorithm is do the blood test and then listen to your body. Then you can figure out which is not functioning so well and think about a functional test for the gut. The two I mentioned were stool studies, not the hospital stool study, not the C. diff colitis stool study. We're talking about, the ecosystem stool study. That means it's a functional medicine lab. Yeah, a lot of people will say, I went to the lab, or a doctor sent me to the lab, it's all normal. Even a stool test is normal. A urine test is normal. Those are disease labs. So if they're looking for a disease and they picked it up, well, you should be happy. But if they didn't, it doesn't mean you don't have a disease or maybe dysfunction. So you need to do functional tests. It's called functional medicine. So that's so the first one was a simple blood test. The next one was talking to yourself. It should always be talking to yourself. Which part of my body is speaking to me? Is it my brain fog? Is it the stiffness in my joints, or worse still, pain? Or is it bloating or gas or bad bowel movements and so forth? Or is it skin conditions? I brought that up already. I speak a little faster. You may have missed it. The skin and the gut, eczema, psoriasis, you name it. All autoimmune disease, gut, right? At some level. And so I would say that the advice for people to say that where does inflammation come, it's okay to say gut. And you don't have to have the breath test. You just have to listen to your symptoms, ask for a few tests, and make a change. Make that change. So the quick answer, and then you can have a follow-up question, would be, okay, what do bugs want? They don't need the fuel that we need, carbs and proteins, fat. Their fuel comes from fibers. Now, I don't want you to go out and get Metamucil because I don't believe in that. But the diversity of fibers coming from a variety of foods like root vegetables and beets and even things like asparagus. So you can find what you like. Onions have a whole bunch, garlic has a whole bunch, and basically you don't have to think about it. Just get a diversity because the fibers there is not for roughage, it's not for solid poop, it's to feed the microbes because the way they get the fuel is to use it and break it down, and that's how they get their energy. And
what about depriving the bad bacteria of what they need to grow?
Yeah.
Is it sugars? Is it bad? What's growing the bad bacteria?
So they are fueled by the refined, the sad American diet.
Right.
So that's, it's not that people don't know, they kind of do. So one of the solutions would be definitely start there, reduce that a little bit. And that's exactly the same advice I gave the dad. I said, first, if the kids are doing it, you better get involved because he's a culprit too. By the way. So this is important what I just said there. It is not just an isolated blood test and a stool test. It's a family issue. This is a dynamic issue.
Right.
It is a cultural issue. We can do this the nice way or not the nice way. The nice way is that you can enjoy your food and it's going to heal. So the way you do it is make baby steps. So the elimination would be very important. Everybody knows it. So I know everyone knows. It's okay. But just do it. Give me that 1 out of 10. Give me the 10%. You could go lower maybe, but it's pretty low. And then start to feed it the right way.
So I'll share. So I go to a functional medicine doctor. I did have dysbiosis of the gut. And I'm one of those people who is pretty fanatical about what I eat, about exercise. So for me, what do you think the number one cause of my dysbiosis?
Are you asking me?
Yeah, what would you guess?
Yeah, okay. Well, he may have had the answer already, but usually, I'm a smart aleck, so you give an answer right away. But let me be patient and ask you a couple of questions.
Yeah.
So first of all, was it during a stressful period of time?
Yes.
Okay. So in other words, you didn't have it before, maybe.
Not that I knew.
Not in a big enough way.
Not that had been identified.
Yeah.
But that's why one of the things I want to really talk about next is stress, because that really was the root cause.
And just to show that I had to butt in here, because I already know she's health conscious. She's not eating Cheetos on a Saturday night watching mixed martial arts.
No.
He's the Kung Fu guy, but
that's the thing. That's what I want people to know, that it can happen to all of us. Yeah. So these are things, go get the test that Dr. Habib is sharing with us. I did, and it's changed. It's helped me tremendously. But finding out the things that feed the good bacteria and the bad bacteria in the gut, and who knew there were trillions of bacteria in the gut. And, I have a million questions about that, how you know which ones to look at and how, I had the fecal sample and the analysis and we saw the bad ones, and the good ones and did it several times, and luckily the good ones.
Well, let me be humble.
Coming back strong and
let me be humble because sometimes it may come off as I'm being brash and know it all, but we don't know a lot. But I'm telling you what we know, and that's quite a bit.
Right.
But there's a lot we don't know. So
stress.
Yeah. So I found out for myself too. When you have back-to-back stresses, you might hurt your gut. So I do intermittent fasting. I don't eat until I finish my workout. That's a stress, and then I eat. And so back-to-back stress. And then, of course, don't forget stress of running a medical practice, right? So be careful about that. But the common phrase, and I probably said it as well, but I've always done this. It was fine yesterday, but you're not the same, right? You're not the same, right?
Yes.
And the stress has probably got a little bit worse because, we have phone. I mean, before I had a Trio, but before a Trio it was a flip-flop phone kind of thing, I mean, there's a lot more, you're just on all the time. The sympathetic drive means on. And so that's a clue, by the way, about where inflammation comes from, is that sympathetic drive at the very least leads to cortisol release, which then releases norepinephrine, which then creates what we call insulin resistance, which is what we want to talk about on our next episode, but we'll get a little teaser, which when you have insulin resistance and high insulin, you can't lose weight. Well, there is a minor problem right there. And you can be sure that inflammation is part of that picture as well. Right, part of that picture. So going back to you, because we didn't forget that could it have been stress? Yes, it could have been. Stress can just cause leaky gut by itself and not the whole dysbiosis. We always want to pigeonhole that it's got to be this or that, and that's why I started off by saying that it's like a moving target, but of course we still have to come to a point where we say what it is, and that's why data is very important, so that the individual can see for themselves. I kind of know, I've seen so many, but the individual needs to see it to kind of understand at that moment in time, even though we know so...
And to make changes, right? Once you see where you are and what's happened to your body, then you have the opportunity to change.
Let me ask you, so what was the strategy to resolve it?
So one of the things that I'm a huge proponent of is Tai Chi. I need to do more Tai Chi. I tell Billy all the time, when I do Tai Chi and I look at my heart rate variability that night, it's always higher. And so calming, it's focus, it's breathing, it's a moving meditation. And it is so good for my body. So, breathing, focus on Tai Chi, increasing my Tai Chi really has helped me. Prayer, meditation are all the things I always do.
And that's what you just said. So the brain is now helping lower that type of potential source of inflammation, right? You don't have to measure it even. You will have problems. And then the other one, which you could do, you could still try to get that bounce back by using some natural ways to bring down the bad stuff, depending on what we found, and bring up the good stuff. And bringing up the good stuff is feeding the right way.
Certainly, certainly. I did a cleanse. I did basically eliminated almost everything from my diet. Started, and put it all back, and started with just healthy foods and put it all back.
One of the important things that you said too, I think, was the idea of baby steps.
Right.
Because if we think about, like I said, people say, "Oh, I've done this all along," and what's happened is there's been cumulative little steps that eventually led to this big problem. Well, we always want to go in and fix the problem, boom, done.
Right.
But sometimes we need to take baby steps to undo that damage, resolve the problems.
The things that didn't happen overnight.
Yeah, and one of the most insidious ones like that, you said it happens slowly, right? It's happening in baby steps. You don't know, I was fine yesterday or whenever that is. And that, we said the inflammation crosses the blood-brain barrier. So by the time you have cognitive problems, you're actually way down the problem. Mm-hmm. And the disservice that a medical profession does is name it MCI, mild cognitive impairment. If it was so mild, how come we can't cure it? It's mild by your definition, but inside the brain, it's not looking really good. And again, inflammation is at the root of it. And so why not? I brought that up because it's a tsunami that's coming. We call it the silver tsunami that's coming. It's where people have worked hard. They deserve the benefits of having their kids grow up and doing well with grandkids. They want to travel and they're healthy. They have the resources, but if the body's not working well, and more importantly, the mind, this is a real problem that's not far away. And so I think the reason I brought that up is to get people's attention that inflammation is not a joke. The gut-brain barrier is not a joke. And we can make light of gut feelings. Yeah, I'm trying to get lighthearted, but I keep getting into more nitty-gritty. But hey, the smile is as light as it's going to get. But I think the brain is a really important one that we're going to definitely hone in on.
So we're going to wrap up here, but what I want to leave our listeners with, because I always want to leave our listeners with a positive step to take. Billy is wonderful at always teaching everyone, all of his students. I'm one of his students, probably one of his most difficult students, but it's true. But reminding us, we get frustrated when we try to do too much too fast, and so he's always reminding us you can only take in so much at a time, and focus on the step that you can take. I don't know if you want to elaborate.
And I've learned from my students too. And one of my students, a psychiatrist, actually introduced me to the concept of a just noticeable difference. And so in treatment, again, we always want to go for this big result. Problem solved, everything is gone. But sometimes what you want to do is have an improvement that's just noticeable. If you can actually notice there's an improvement, that's enough for now. More. And then you have another step, then another step. And eventually you can resolve things. And a lot of that has to do with what you were saying about earlier, you mentioned awareness. And one of the lessons we've been talking about this week, concept was in Chinese they call Tingjian, which is listening energy, which really means awareness. It's paying attention with all of your senses. And you have to have awareness of self. You have to be able to identify where you are to then determine how to get where you want to go.
And I think that's what we're doing here, is helping people understand that. And what they think is small, measurable, physiologically, biochemically in the body, they're major positive changes. You often see big changes and very little symptom. If you're seeing measurable steps of improvement, that's a big deal. And so the last time we talked about the sleep, don't damage it. And this time what we were saying, so that still applies. The next one would be just to eliminate something that is not good for you. Like what I did about my chips is don't buy them. Because it's there. And this is kind of funny. This is kind of funny. Because I told my wife, don't buy them. And so they're not there. So what happens? Where are the chips? Where are the chips? Then after I stopped crying like a little baby over the several years, I was fine. I got over it. But once in a while I cry for, where's the chip? But I had a hidden stack for that one. Okay. So now the anything refined out of a box, coloring, stuff like that, we don't need to go down the list. Try to do a little less. One day of the week, whatever you feel like doing that, and it's got to be doable so that you can accomplish it. Then you can move on to the next one.
Move on to something, something else. So,
and I would say a little bit more. Do it and just keep it going. That it's now ingrained. No, I did it. Now the next day I'm going to do it. I would just keep it going, so it's easy, and I can do this so good that then you're on the right track. So avoiding and then giving yourself something. So the way I phrase it is, you're not feeding yourself, whether it's a protein diet, carnivore diet, and a keto diet, whatever. What you're doing, the food that the microbes are looking for is diversity in fiber. You don't need to become complete vegetarian, but just incorporate something. And I'm going to give you the big ones that has been studied, which would be the kind that are under the ground. We describe them as resistant starches or root vegetables, because they have fibers. And I'm making this way more complicated than it should be, basically, but I want to. So potatoes, which is all demonized, but if you have a potato that's sort of half cooked and it's kind of a little crunchy, that's evidence of resistant starch. I just said resistant starch, not fiber, but that it's resistant to your digestion, but your microbes can digest it. So your fibers in vegetables are not digested by you, but your microbes can digest it through fermentation. So fermentation foods can be part of it as well, frankly. And so spring onions, as well as asparagus. And I bring those up because some people actually like them. And but any diversity, but just pick one and do it, whether it's peas or carrots, whatever. It's all good.
So we're going to leave you with that. We're going to leave you with on the positive perspective that Inflammaging is not your destiny. It does not have to be your future. If you take some of the steps that we've talked about today, and we will continue to build on these things about inflammation and share more with you as we have more information. And Dr. Habib will certainly be back to share more with you. Speak to your doctor. You can go to nexthealthmed.com, which is Dr. Habib's website, which is full of information. You can visit him in person in Ashburn, Virginia, or Bethesda, Maryland. Or there's other functional medicine doctors. I don't know if you have referrals for people in their area, but we'd love to help you. And we thank you today for joining us. Bill, final words?
Yeah, just again, that message, small steps can lead to big results.
Dr. Habib?
Don't have to overdo it.
Final words.
Final words. Don't put bad stuff in.
Thank you, everyone.